PMS, PME, PMDD, they all sound similar, but they're all so different. And it's really important that you know these differences so you can get the support that you actually need. I used to call everything PMS. It wasn't until I actually learned what the differences was that I was able to truly support my body. In this video, we're gonna break down what each one actually is, how the pattern of each one across your whole cycle, and why it matters for getting the right support. I'm gonna start with some simple definitions. So PMS, Premenstrual syndrome. This is a cluster of emotional and physical symptoms that you get before your period. So think breast tenderness, fatigue, feeling a bit more emotional. The important thing is that you can carry on with your day-to-day life. It doesn't derail you. Then we've got PMDD. So that stands for premenstrual dysphoric disorder. This is different from PMS. So how it differs is that this is actually a mental health disorder. And the things that you can suspect if you have PMDD is intense rage, really upsetting intrusive thoughts, severe muscle aches, and in general, PMDD disrupts your relationships with yourself and with others. I'll link a previous video on PMDD so you can understand it in more detail. And then we've got PME, that's premenstrual exacerbation. So what that actually is, the worsening of a pre-existing condition. So if you've got bipolar, anxiety, depression, things that are pre-existing, these get noticeably worse during your period, but you still have these conditions all month long. So how this all gets clearer so you can get more of an understanding of what camp you fall into is by tracking. So with PMS, you probably feel pretty good for the majority of the month. A couple of days before or when you start bleeding is when you start feeling symptoms, breast tenderness, back pain, feeling a bit more weepy, but you don't tend to feel these symptoms throughout the month. With PMDD, you're likely to feel a very noticeable hell week. This is often when you feel intense rage, intense depression, times when it's so difficult to get out of bed and do your daily functions. This is when you'll notice that if you've got a partner, you'll be snapping them every second and you'll feel an intense rage and oftentimes intense hopelessness and thoughts that you can't necessarily control. These symptoms often alleviate dramatically once you start bleeding, and then you feel like yourself again for the next week or two, and then the whole cycle begins again. However, with PME, there's never a symptom-free window. As you already have an existing condition that gets worse during your menstrual cycle, you're always feeling these symptoms. However, they intensify as you lead up to your menstrual bleed. Recap, PMS, you feel relatively fine all month, and then you have a few days of non-life altering symptoms. PMDD, you feel okay for maybe the first 2 weeks of the month, and the second 2 weeks, you feel like a different person that has intense rage, intrusive thoughts that severely interrupt your day-to-day life. Thirdly, PME, you have a condition all the way through the month. However, in your menstrual window, those symptoms intensify. Why having these labels matter? It matters because if you label everything as PMS, how can you get the support you need? As you can see, they're all very different conditions. By labeling them, you empower yourself to get the support that you need for your body. There are simple things that you can do to help tell the difference between each one. Number one, start tracking daily. I have a free tracker in the description bar if you need one. Tracking helps you to see, is there patterns? Does it feel like your symptoms come out of nowhere and they're so intense that you can't do anything? Or are your symptoms always there but they get worse? This helps build a picture, and this picture will be helpful if you're looking for support. If you're prepared, it makes providing that support to you so much easier. Number two, as you're tracking, notice what is changing. Do you get more emotional symptoms, or do you get more physical symptoms, or do you get a mixture of both? All this information paints a picture of how to best support your body. And number three, if you already have a diagnosis of depression, anxiety, or anything else, do you notice a difference? So before your period, does your pre-existing condition get worse or does it remain the same? I'm not telling you to become a doctor and diagnose yourself. This is not what I'm trying to say at all. I'm trying to encourage you to get to know your own body so you can advocate for yourself. What I'm trying to encourage is that you understand your body and you understand what changes happen. This helps to empower you, and if you ever choose to seek external support, you have a foundation of what you know is right for your own body. So if you recognize yourself in anything that I've mentioned, it's so important that you realize that you are not alone and that you are not weird and you are not abnormal. When you can name something, it empowers you to support yourself. When you can name something, it allows you to be able to move forward and find the correct support that you need.